This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
We have Chris Saxon, Director of Environmental Health, and also Dr. Cord Law, our Chief Medical Officer. And we have Joanne Rupiper, our Chief Administrative Nurse and leading our vaccination campaign. And also we have Chief Greg Cassell, who is our incident commander for our vaccination campaign. First, I want to share with you that right now we are at a very critical point in our vaccination campaign. Until yesterday, we have a total of 829,000 people in Clark County who received their first dose of vaccine. It represents 45% of the eligible population. In addition to that, we have 562,000 people who already completed their vaccination here in Clark County. And the grand total of vaccines administered in Clark County until yesterday is more than 1.3 million doses. So those are great achievements. Still, we of course have a challenge. We will have the intention to keep working on this vaccination campaign, and we set our target of having at least 60% of the population, eligible population, who already initiated the vaccination, actually completing at least one dose. And once we reach that level, it will help us easy the issues with capacity and social distancing. I also want to mention that the Casman Center, which is one of our two current mega vaccination centers, will cease activities in May 5th. At that point, Las Vegas Convention Center will become our main mega center, and capacity will be expanded there. In addition to that, we also will start offering other vaccination opportunities for our community. For example, we will start a 6-week drive-through vaccination clinic at Texas Station. And also there will be multiple venues offered for vaccination in our community. Some of those I will mention today, but there will be even more. Is the Hollywood Recreation Center that will be offering vaccination in April 27 and 28. And this is a coordination with the Commissioner's Secretary's office. Also, we will offer vaccination at the JC Senior Community Center, Mobile Home Park, on April 29. Also, the Searchlight Community Center on April 30, in conjunction with the Clark County Parks and Recreation. And we also will offer vaccination at the Bob Price Community Center in conjunction with Commissioner Kirkpatrick on May 1st. In addition to that, there will be other vaccination events offered to the community. I also want to mention that during the first week of May, the vaccination clinic that is currently being offered at our main facility in the Cattle Boulevard, we will move that service to our non-congregate shelter, which is the new building adjacent to that facility, where our team will start offering the COVID vaccine there. And the reason for that is because we want to allow our immunization team to be able to offer the regular vaccine to our children who will be preparing for the back to school events through the summer, as we know. I I also want to mention that the Southern Nevada Health District has identified 73 cases of uh, breakthrough infection. Breakthrough infection means people who have been fully vaccinated but have developed the disease after at least 14 days after the second dose. This number, 73 cases, is a very small number. Is is really small compared to the expectation from the efficacy of those vaccines that, as we know, both Moderna and Pfizer have a 94, 95% efficacy, and Johnson and Johnson 72% efficacy in the United States. The 73 breakthrough infection cases that we are reporting here in Clark County represent about 1 out of 10,000 people vaccinated, which is way below the expectation based on the efficacy of those vaccines. I will stop here now, and I will ask Councilman Scott Black, Chair of our Board of Health, please.
Morning. Thank you, Dr. Legan, and thank you to those of you that have joined us this morning. I appreciate the opportunity to make a few important points regarding our vaccine effort and our effort against COVID-19. As we move to a more regionalized response to the COVID-19 pandemic, I will now be able to make more flexible and tailored actions to respond to the very unique needs of the jurisdictions that make up all of Clark County. We'll be able to hone in and focus on the things that really make a difference and make a big impact here locally. Our response and our local mitigation efforts are going to continue to be science-based to protect the health and welfare of our community. And this indicates that we'll be able to live, to work, and to play in an environment that is as safe as it possibly can be and as healthy as it possibly can be. As been stated before, a significant part of our mitigation plan is truly tied to members of our community to become vaccinated. The COVID-19 vaccines are safe, they're effective, they're free to anyone who wants one. And we all are aware of the recent pause in the Johnson & Johnson vaccines, and understandably, that's concerning to some folks. However, if you look at the rapid way and the transparent way that these rare events have been addressed and made known to the public is an indicator that there is a tremendous commitment to the overall safety of this vaccination effort. I just wanted to note that nationwide, there have been over 280 million doses of the Pfizer and the Moderna vaccine, and they have not found these rare side effects occurring in those. And here in Clark County, as Dr. Legan stated, between the health district and our partners, we have administered over 1.3 million doses of the Moderna and the Pfizer vaccine. We're very close to our goal of 60% of eligible residents being vaccinated with the first dose of COVID-19, and that will give us an opportunity to be one step closer to removing the social distancing and capacity requirements. We're also reaching a point in our campaign that the people that were eager to get the vaccine have done so, and now we're reaching out into groups within the community that maybe have a little bit of reluctance or hesitancy, or perhaps they're concerned about what type of impacts the side effects may have on their day-to-day life or their employment, perhaps also getting appointments. So it's important to note that we have a wide range of appointment opportunities. We have the Cashman Center, we have the Convention Center, we have many sites throughout the community, expanded hours. You can get a vaccine virtually any day of the week here in Southern Nevada. So for those individuals that have been waiting or were concerned about the vaccine, you still have a great opportunity to get it, and the accessibility and the availability of the vaccine is far greater now than it ever has been. In terms of the side effects, the vaccine side effects, if you happen to get them, have been known to be very mild and may last only for a day or two. I can only speak for my personal experience, but when I received the vaccine a few months ago after the first dose, I had zero side effects other than a little bit of soreness in my left shoulder where it was administered. And when I received the second dose 28 days later, about 24 hours after that second dose, I had very, very mild aching. I took some Advil, And about an hour later, I felt perfectly fine. Now, that's just my personal experience, but the side effects truly were very, very minimal. In my role as the Southern Nevada Health District Board Chair, as well as a city councilman, I've seen the devastating and overwhelming impacts of the COVID-19 pandemic throughout our community. It's affected people mentally, physically, of course, economically, and in many cases, all of those things have been the negative impacts on our community. And I just wanted to state that we're taking the steps that we need to take as a community and as leaders to return to normal and to fully open, but we have to do so in a responsible manner. And once again, I just wanted to state that our success in reaching our goals and overcoming this pandemic truly depends on cooperation and participation from you, our community members. So if you haven't been vaccinated yet, I encourage you to do so. If you already have, talk to someone who has not, encourage them, someone that you care about or that you know well, to encourage them to get the vaccine. You see on the TV, the media likes to show the up close injection site and the 2-inch needle going deep into the arm. Even though that looks scary and painful, it really I barely felt it. And so I just wanted to thank everyone for doing your part. Let's continue to do our part and get to the goal of 60% and get back to normal in our community. Thank you, Dr. Legan, for the opportunity.
Thank you. I will invite now Commissioner Kirkpatrick, please.
Thank you, Dr. Legon and Councilman Black. I think you both said pretty much everything I was thinking. I just want to reiterate that it's very easy to get the vaccine. We'll be in your neighborhood. We look forward to seeing you at Bob Price next Saturday. But just a reminder, it's very easy, and we all are working hard to get that 60% fully vaccinated so that we can get back to normal. That's all I have.
Okay, thank you. Okay, Corey, would you please open for questions?
Absolutely. Okay, anyone in the media who has a question today, please raise your hand. And when we unmute you, also please identify which media outlet you're with, please. First up, we have Victoria.
Hi, I'm with KLAS here, Channel 8. I'm just wondering, yesterday we had the meeting with the state's task force. When can we expect a decision by the governor to approve on Clark County's plans?
So that I'll take that. So there's a process that they go through, but we had a very glowing review of our plan. There was a lot of work put into it regionally. So we anticipate the first part of next week that we will hear something from the mitigation task force.
Our next question today comes from Denise.
Hi there, Denise Rush with Channel 3. I was wondering if you could tell us a little bit more about the drive-through vaccination that's going to be set up at Texas, when exactly that starts, which vaccine we'll be using, and really what that will look like if people have to come back for a second vaccine, just how all of that will work.
Okay.
Okay, so this is Greg Castle here. Denise, thank you for that question. So it's going to begin on May 11th. It'll run, currently set to run 7 days a week from approximately 7 in the morning till noon. It's going to be run by the National Guard and in conjunction with the Southern Nevada Health District. Pfizer is going to be the medication given at the drive-through. So we are planning to do 3 weeks of first dose Pfizer and then follow that with 3 weeks of second dose Pfizer. And our operational period for that specific drive-through will end on June 14th. So it gives us 6 weeks to get as many as we can do in a day. We're planning for 1,000. If the appetite is there by the public, we can go up to 1,200, maybe a little more.
Thank you, sir. Our next question is from Mary.
Hi, Mary Hines, Review Journal. To follow up on Denise's question, can you tell us how you think this drive-through effort will help you reach people who are vaccine hesitant or just vaccine indifferent?
We're hoping that there's a group of people out there that will come and attend this drive-through process because they might see it as easier. They don't exactly meet the homebound criteria for a homebound system, which is a much slower delivery of vaccine because it's so much to go out to people's homes. And maybe they don't want to go to a large site. Maybe they want to bring the whole family together at one time. Mm-hmm. So we're not really sure how many people will show up, but we've had a few people that have been in the homebound saying, hey, I would have done a drive-through if it was available. So we're hopeful that people will come, but we don't exactly know how many people will show up.
And regarding the vaccine hesitancy, what we're doing is trying to reduce barriers to getting the vaccine, and that's what the drive-through campaign would do. For vaccine hesitancy, there are some people who want to wait and see yet, who are unsure, and those are the folks that we need to educate and reduce barriers so that they will take the vaccine at this point.
Next up, Jacqueline. Hold on. There you go.
Hi, everyone. Thank you for having this morning. Certainly ASIP today, we are hoping and waiting for word as to what will happen for the Johnson & Johnson vaccine. How has the campaign had to pivot since the pause? And obviously we don't know what's going to happen, but how is this slowing down the number of people vaccinated in Clark County and getting to 60%?
So from the vaccination efforts here, thank you, Jacqueline. That's great, Castle. We can't quantify how many people are not coming because of that Jackson or that Johnson issue. Things have slowed down across the entire country, and we can't tie any specific number, ratio, or any other quantifying factor to the Johnson issue.
And some of the activities that we do, we were using Johnson because the criteria for the use would be those that are less likely to return, right? So that did pause for a bit, but we pivoted and used other vaccines, Pfizer and Moderna, and we are using those in those populations.
I would just add that Jacqueline, I think it's important that you know that when we started the vaccine campaign rollout, that we didn't start with Johnson and Johnson for one. So we actually incorporated it into our overall plan. So we have been flexible from day one on how we incorporate, and we've been able to break down many barriers, offered many different options, which makes us unique across the country, right? So we knew mass vaccination sites were important to us. We now know that there still was a demand for some drive-through, so we wanted to offer that going into the neighborhoods. So we've made huge strides in Clark County in particular because we have been able to be flexible and we've been able to integrate many different aspects in a day's notice. And that really is a tribute to the folks on this panel today, but also, you know, over 1,000 men and women that are working boots on the ground to make sure that that happens. And I never want that to be lost because we are very fortunate in Clark County that our collaboration is so good that it's not really a chore to pivot. It's just a new day with a new direction. And that's what's made us successful so far.
Another challenge.
If any member of the media has a question but has not yet asked it, please raise your hand at this time. In the meantime, we will take a follow-up from Mary, and if there are no other English questions, we will then move on to the Spanish.
Hi, just to clarify, Greg, you said the plan is to give up to 1,000 or even 1,200 vaccinations. Is that per day?
Yes, that is per day.
Sounds ambitious.
We're hoping it's successful. We're hoping people really enjoy the opportunity to get it via a drive-through. That's really our hopes.
We, if I may make a comment really quick, Chief Castle, we did an experimental drive-through vaccine site at City of North Las Vegas City Hall a few Saturdays ago. And, you know, we didn't have quite the size of the facility as the Texas, but we still were able to do, I think, close to 500 doses in before noon. And so I think with the scope of the people that you have available and the size of the capacity of the venue, I don't think you'll have a problem doing 1,000 or 1,200 a day. It's just a matter of getting the folks out there to partake in the opportunity. And that's really our goal, is to encourage people to take advantage of this. Like Marilyn said, one more unique avenue to make it easy to get the vaccine. I think from a procedural or operational standpoint, I know you guys are going to be in great shape to be able to handle anyone that comes up to that big number.
Yeah, thank you, Councilman Black, because the staff that are doing that clinic are very well trained. They're from Las Vegas Convention Center and Cashman, so we don't anticipate any issues with that. Thanks.
At this time, we're going to take one quick follow-up from Denise, and then any closing remarks from the English portion, and then we'll move on to the Spanish.
Thanks so much. Just yet another follow-up to the drive-through. Is that appointment only? Can people just show up?
That is appointment only. The appointments will be available on the snhd.org website.
And keep in mind that many times we have same day appointments. So even if you show up, or even if they, oh, maybe I can get in today, check our website, and they can also call if they have difficulties getting through the appointment system.
And like our other sites, depending on the public's response to it, if we've only got 500 booked, we can move pretty quick to some walk-ins. But walk-ins with drive-through is a challenge, because then you end up with potentially hundreds of people showing up at early in the morning and clogging up the roads. Lake Mead and Rancho. So we're going appointments only, and we can accept a few straggling walk-ins in the latter part of the day for people that don't show up. But right now we're doing anybody and everybody at the big sites at Convention and Cashman, because we're just not getting the volume by appointment.
Just a quick reminder to everyone, the direct link to our COVID vaccine distribution page on our website is www.snhd.info/COVID-vaccine. That'll take you straight to the page that lists all of our health district or partner locations, as well as a few community vaccination clinics. Does anybody have any closing remarks before we move on to the Spanish? And seeing none. Oh, wait, did you have something?
No, okay.
Go ahead.
So go ahead, John, go ahead.
Oh, I was just going to say that the time for procrastination is over. We have a couple of months of resources of these mass vaccination clinics where we have a lot of appointment capability. And if you've been thinking about doing the vaccine, then please come as soon as possible. We're going to be going into back to school activities in July and August. And as you know, if any parent has ever come for our back to school clinics, you know that that's a hectic time. So we really encourage you to get the vaccine now, get our percentage up to 60%, so we can all, go out, work, live, and play just as before. Thank you.
Yeah, thank you. No, I just wanted to say that the next phase of our campaign actually is more about heavy community engagement, and we plan to go close into the neighborhood. We are planning and already started working with multiple community partners, because we want to bring the vaccines closer to the neighborhood. So it's not just about the mega sites, it's also about bringing the vaccine closer to the people in this community. Thank you.
Thank you for joining us. And we will move on to the Spanish portion right now.
You've been watching breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.